Hi, my name is Dr. Sharmin Aktar and I'm a HCPC registered counselling psychologist and I'm the clinical director here at The Mind Remedy. In this video, I'm going to be talking to you about what typically happens in an initial assessment with a psychologist. So there are a few different areas that are included in an initial assessment, starting from current concerns, developmental history, risk and safeguarding, and also your goals. The very first areas that will be discussed in an initial assessment is your current concerns. So that would include discussions about what it is that you've come to therapy for, how long it's been going on for, what impact it's having on you and your life. So that might be your social life, your work life, your relationships, your family, etc. The next part of an initial assessment includes your developmental history. So that could include information about your childhood experiences, your relationships with others, your parents, your siblings. It would also include information about your medical and your physical health, whether you've been to therapy before, whether you're taking any medication at the moment, perhaps any traumas you've had in the past. So those are the types of information that a psychologist would be interested in. So the next part includes risk and safeguarding. Now, this is a really sensitive topic and it can be really difficult to talk about. So please do take your time and your psychologist will be here for you to support you through this. Questions in this section could include questions in relation to your current and past self-harm, your current and past substance abuse, your current and past suicidal attempts, whether you have any suicidal ideation at the moment, whether you have any intentions to carry them out, and whether you have the means to carry them out. Remember, these questions, although difficult to answer, is more about keeping you and others around you safe. The final part of an initial assessment would include goal setting. This is where you and your therapist would work collaboratively to agree on specific goals that would set the direction for future sessions. SMART goals stands for specific, measurable, action-orientated, realistic, and time-bound. Once you've agreed on this goal with your therapist, then you can use it as a direction for therapy, and it's also something that you can refer back to check in with the progress that you're making. It's important to remember that everyone is different. So that means every client is different, every therapist is different, and therefore the structure, the questions of each assessment will differ from person to person. I hope this video has given you a little insight into how initial assessments look with a therapist. If you have any questions at all, please don't be afraid to contact us. You can email us at info@themindremedy.co.uk.